Okay, so if you have a dog or you hike a lot, you may know this already. New England is currently experiencing one of its worst tick seasons in years.
And ticks are the worst to begin with. We are seeing more tick-borne illnesses as well. WBZ's Louisa Moller's live in Quincy with the warning signs that we should be looking for. Louisa?
Well, Lisa, Courtney, let's start with one very important detail. There are a couple different types of ticks in our area, but there's typically only one that carries disease. That is the deer tick, also known as the black-legged tick. It's super small, about the size of a freckle, and there is some evidence that there are more around this season. Who's on your shoes? You know that guy?
Flounder. Is he a fishy?
Yeah. 2-year-old Jamie likes fish, but there's some other summertime critters that Mom Jen has no tolerance for.
So that's how you get rid of the tick. It's kind of like a hook, and you pull them up and out.
Okay, well, I need to take some lessons from you, Mom.
Carrying around her tick bite prevention kit after a scare with her little guy.
So then he got a rash, and we had to go in and get checked for Lyme disease, and luckily he didn't have it. The rash went away, but it has been a frustrating season.
Data from the Centers for Disease Control shows her fears are not unfounded. Emergency room visits for tick bites in the Northeast at their highest levels in at least 5 years, with 229 bites per 100,000 visits in June of this year versus 167 per 100,000 visits last June.
Notice it does not have a pale center, and it does not have a target in there. And sometimes people miss it because they're waiting for the target. Don't wait.
South Shore Health infectious disease specialist Dr. Todd Ellerin showed us a picture of a telltale Lyme disease rash. But he says there are other illnesses that can come from the tiny deer tick, which presents sometimes no bigger than a poppy seed. If you just have a tick bite you, what would you recommend?
Right. If it's a deer tick, and if it's been attached for at least 36 hours, then you want to call your provider, because we can give a single dose of doxycycline, 200 milligrams, and that significantly decreases the risk of developing Lyme disease.
What's with the increase? Dr. Thomas Mather, the founder of the University of Rhode Island's Tick Encounter website, says deer ticks, also called black-legged ticks, have been able to survive longer in this spring's humid conditions with fewer hot, dry days.
So we had good conditions in May and June for tick survival, black-legged tick survival, and that has caused the number to be higher.
Now there is some good news, and that is that deer ticks typically die as the weather gets hotter and drier, and those days are just going to increase throughout the summer. And experts like Dr. Mather seem to think we are already past the peak of this tick season. Live in Quincy, Louisa Moller, WBZ News.
Louisa, thank you.